All my life I had soft teeth. They used to call them chalk teeth, as a matter of fact. I had a lot of infections, I had gum problems, a lot of my teeth started to come out. I had to have partial bridges.
I started losing my teeth around when I was 22, 23 years old. For many years I had partials and I had problems.
More than 120 million Americans are missing one or more of their teeth. Despite the challenges missing teeth can create, many people, especially those with insufficient bone volume, are often discouraged from replacing them.
Standard protocol for people without teeth would be to place 8 to 10 implants. Unfortunately, people without teeth do not have so much bone that allows you to place 10 or 8 implants. Therefore, they would go for a bone graft. Bone grafting is not so successful in elderly people. It is time consuming, placing the teeth in about 1 year later, and it's costly.
The bridges clicked when I talked, and that's like a mortal sin in my business, being in radio and doing voiceovers. The thought of having completely removable teeth really scared me.
I could not eat, I could not smile, I was ashamed to open my mouth.
Recognizing the limitations of conventional dental reconstructive options and driven by concerns for his patients, Dr. Paulo Malo was determined to find a better solution.
I cannot accept that someone has to have dentures for the rest of their life. This is very limiting in terms of quality of life. So I set up to develop a way that we could deliver a fixed bridge without bone grafting.
The idea of replacing missing teeth with a non-removable bridge that was supported by only 4 dental implants with immediate function was a radically new and controversial concept.
This particular technique is a disruptive innovation. Every disruptive innovation is controversial, so people need time to adapt and to believe. In that particular case, was 10 years.
This innovative protocol soon proved to have a better success rate than the standard approach, and now hundreds of dentists worldwide are adhering to this technique.
The main goal of this technique is to make it easier for both the patients and for us dentists. And we really achieved to treat some very difficult cases that we could not do that in the past.
This particular technique avoids bone grafting in most of the cases. Therefore, by avoiding bone graft, the success rate is higher, the level of comfort for the patient is much higher, the cost of the patient can drop 50%, and we can place teeth in the same day.
It's really amazing what they do. In one day, they pulled all of my remaining teeth. They put 4 implants in the top, 4 in the bottom, then they screw the teeth in the top, screw the teeth in the bottom. It's like the closest thing to having my own teeth.
Evidence-based dental implants have been around for over 40 years. They've been proven and tested in the hands of experts who are trained and credentialed. They are very, very safe. When patients seek the care of experts, they need to figure out how they are trained, where they are trained, and what their credentials are. Our success rates have exceeded what is available with conventional dentistry. They have been utilized worldwide with predictability and tremendous amount of survival statistics.
Malo is a world leader in implantology and dental aesthetics present in the 5 continents. The innovative all-on-4 Malo Clinic protocol is a breakthrough in oral reconstruction. The surgical procedure provides the placement of fixed teeth with immediate function in just 1 day.
The all-on-4 technique was developed to avoid bone grafting in most of the cases. Because it avoids bone grafting, it allows the patient to have fixed teeth in the same day, even if there is osteoporosis, diabetes, or any other type of disease that will not apply if the patient has to do a bone graft. The surgery itself takes about 1 hour, which is very comfortable for the patient. The teeth are placed in the same day. These teeth, they look like, they feel like, and they function like a natural dentition. The success rate of this technique is higher than the standard protocol, and the cost can be as low as 50% of the standard protocol.
This is absolutely amazing to me, that in 1 day you can have all of your teeth. I treat them like my own teeth. I use a water pick, I use a toothbrush, and the only time they come out is when I go in for a cleaning.
Probably the most powerful thing about this protocol is how predictable the results can be. And that is very rewarding because you don't want to to have your patients happy in just one day. You want to have your patients happy forever.
I'm recommending these to every single person that I know. And I already said the same to hundreds of people, because they come to me and they say, show me what you did. And I open my mouth, see, it's perfect. And they said, I want to do it.
It's been the best thing I've ever done for myself, aside from meeting my wife.
Malo continues to be a global leader in innovative solutions in the field of dentistry.
Malo Clinic today is present in 24 countries. Today is a global brand and a world leader in oral rehabilitation. That is because of R&D. R&D for us is essential to be today number one.
I met Dr. Malo about 5 years ago when I invited him to present at a major international conference. He presented some revolutionary ideas and concepts which was not imagined a few years ago. The benefits of what he has to transfer is reaching worldwide proportions, and we can see more and more patients being treated through his methodology. And at the center, we believe in customizing treatment options for our patients, and that's a philosophy that I share with Dr. Malo.
To find out more about the all-on-4 dental reconstructive procedure, go to malosmiles.com.